In this video, we're going to learn how to process a treatment consent form. This is really important for us to know, not only client service representatives, but also the technician and assistant staff, just in case patients come in that we need to admit on the fly. And it just helps kind of ease the flow up front and gives them a little bit of a break. So I'm going to be going over it with you guys. I'm going to zoom in just so you can see the computer a little bit better. So to start off, we're in the schedule. If you're looking up a patient, I'm going to use my client information and patient information to use just for a sample of this video. So you'd look up, the client and the patient just as you normally would. So I'm going to go into the patient clipboard. And I'm going to go into searching for the client ID. I'm going to use myself as an example. And we're going to use it on Josie. So there's a few different ways that you can get to the form, just like you can any other medical note. You can either right-click on kind of the summary history right here and go into correspondence. And then you can go into all correspondence, or actually it is listed here on the drop-down menu. I'm just going to zoom in a little bit more for you guys and just move this. There we go. So it is listed here, but I wouldn't go by what this is because these change all the time. So you can go into all correspondence. And then you just put in your initials. It doesn't have to be a doctor. And then you do treatment. And it's right here. And you can see in this document note here that these correspondence checkboxes are filled with a checkbox. So that means that we are looking, in fact, in correspondence. So that's one way that you can get to it. The other way is if you go up here to this mailbox, and then for this, you actually do have to kind of F2 and search, and it'll be whoever the last patient is that you brought up, and if for some reason, if that patient isn't the same, you can look up your patient right here in the last name and first name, or if you know the client ID number. But since this is who we're going to be using, we pick the patient, which is going to be Josie. And again, I'm going to put in my initials. You go into the title of the form will be treatment, we search, we find it right here. So now, this is the second way that we're doing it. And again, you can see all these checkboxes right here are checked off. So that means that we are in correspondence. That's what this form is under for the hospital document. So we double click on treatment consent form. So then it gives you the form and you kind of review with the client. This form is giving us consent to treat your patient here at Falmouth Vet Hospital. And it does review some things for them as well. So it's good to know obviously what the procedure to be performed is. So whether this is an admit, say we get busy in the morning and a technician or assistant has to kind of step in and help the doctors with their admits for the morning, this is also going to be a helpful task for you guys to know. So we want to know what procedures to be performed, and if you do know, so say this is a surgery and it's a routine spay, so we put OHE as the procedure to be performed. If it's a dental, you would click off dental, and you would discuss with them, are we having full mouth radiographs, are we not? Again, this is kind of more for the doctors that are going to be reviewing during the admit, but it's also good if you're the one doing the admit of the patient to know what's going on as well. If it is a patient that's going to be hospitalized or just treated for a workup or anything, then we would click this admit button. And if you knew what it was, so say it was, IV fluids, then you would just put IVF as what you know. It's okay if you don't know, you can just skip the part as far as the procedure to be performed, but do click the admit button. So then, the next question is permission to post photos on social media. So this is good to ask, you know, for routine procedures. Obviously for sick patients, you know, we don't really want to, you know, ask clients, you know, is it okay to post photos, you know, because if they're upset about their pet or if they're not happy because their pet is sick. So it's good to ask for routine things. So you can click that off. And you also want to ask if their patient needs to be microchipped. Again, you can look in the patient file to see if this exists. If it does, actually I'm going to scroll back up here. There's this area right here on the consent form where it would be present. So Josie does not have a microchip. So if, for instance, you know, that is blank, that would be a good question to ask, but it's good to be mindful and see if there is a number on there so that we don't have to ask them when they, you know, will probably respond, oh, it's in their file, you should have the number in their file. So it's just good information to know ahead of time before you review the form. And then also pre-anesthetic blood work, so that's another good thing to know. Are we, you know, especially for dentals and surgeries, because we will routinely do it if they would like us to, and we do recommend it. So that's another box that we will check off. So then, before we have them sign, we do want to know what number they can be contacted at today. So this is going to be a primary number that you can list in here. And I wouldn't go by what their primary number is in their record, because who knows where they could be. They may also give you a number of someone else that will be taking responsibility for the patient that's going to be dropped off. So it's really important to ask this question, probably one of the most important questions that you ask before they leave, because this is our primary form of communication once they leave the hospital and they leave their patient with us. Texting updates is another question that you can ask. Again, this is another one that we'll use for follow-up post-surgery or dental. And I'm just gonna put my number in here just to be thorough. Alright, so once you have the number, you have all your questions answered. We know what this patient's coming in for. Then we have to process the form. So I'm going to just process this through just so you guys can see the whole thing. So for signing the form, so there is a sign keypad in every exam room at this point in time. And to sign, you're going to press this little pen button up here. It's this little icon right under where it says edit. So client signature, if you hover over it, that's what it's going to display. So you press that button, and then it's going to come up with a signature pad. So then we have our signature pad, like I said, in every room. And then we're just going to sign. Okay. So then they sign. You click OK. And then it gives you a prompt to print. We don't need to print this unless the client specifically asks for it. So it is there in case they want proof of this form. There is a laminated copy up front if they need to view the form actually itself, you know, because we do go over the form and go over the questions with them. There are some computers that aren't like this where we can show them what we're doing. So there is a laminated copy up front that does show actually the form itself, so that if they have any other questions, or if they're like, what am I signing? You can just refer to that up in reception. So we don't want to print, so we can just cancel through that. And then, and once we get out of it, it'll appear in their record, and then we can just access it through their patient clipboard.